So I guess you guys are talking about bacterial meningitis and the new vaccine that's out there. So I was just wondering if you could sort of tell me, what is bacterial meningitis and why is it so serious? Why should our readers who are mothers, they're about 35 to 50, why should they be paying attention to this?
Okay. To start with, we're going to talk about meningococcal disease. Meningococcal disease causes two primary manifestations in children and teenagers and infants. And that first one is meningitis. Meningitis is a serious infection of the covering of the brain and the spinal canal. It causes marked neck stiffness, horrible pain, headaches, fever, and the child just looks very, very ill. The other way it manifests is through a bacterial infection of the bloodstream. This is called meningococcemia.
I contracted meningococcemia when I was 14 in 1999. I was away at a sleepaway camp, and one evening I came down with what I thought was the flu. So I just figured I'll go to the camp infirmary and rest up, and 1 or 2 days later I'll be as good as new. The next morning the flu symptoms were just getting worse and worse by the minute until I was just in extreme pain. I was having problems breathing. I had developed a purple rash all over my body. I couldn't really feel anything from about the abdomen down, and I couldn't stand up. I would collapse on the floor. 911 was called, and I was rushed to the hospital where I was induced into a coma, where I stayed for the next 2 months. Over those 2 months, I was given about a 10% chance of survival, and I had everything from organ failure to 108 fever to a collapsed lung. I dropped down to about 50 pounds, and I had to have my legs amputated at the knees and my hands amputated at the forearms. When I woke up 2 months later, I was very shocked to find out that I had contracted bacterial meningitis. And I was even more shocked to find out there was a vaccine that I could have gotten that would have prevented it.
When do we need to take this vaccine?
Okay. There are two vaccines available. One is called Menactor, which has been out for about 5 years. And the second one is the brand new one called Menveo. And it's both of them are available. They both are FDA approved for folks ages 11 to 55. The target population for both these vaccines, though, is 11 to 18-year-olds for the most part. Kids that are going off to college need it. Any military recruit should get it, and people who travel to other parts of the world where there's certain special cases of high risk for diseases such as meningococcal A in Africa.
The vaccine is actually very important because many cases, such as like my case, they just come on so fast, and they come on to healthy kids.
And now what about for mothers themselves? Would they need...
Yes.
They don't seem to be in the target group, but if they're caretakers for their parents, or is it more just they should be looking out for their own kids' health?
Primary target, again, is the 11 to 18-year-old age range. The highest incidence actually is in babies under a year, but we don't have a vaccine for them yet. We're working on it. We've got several different companies working to get that vaccine. So that group is still on the horizon. Probably the next several years we'll have something for them. But as it stands now, the second highest risk group is the 11 to 18-year-old population. So that is the primary target for the vaccines currently.
Is this something that if we're just bringing our kids to their regular checkup when they're 11 that their doctor is going to give to them, or is it something that these mothers would have to request? It's
variable. If you come to my office, you're going to get the vaccine unless you absolutely decline it and you have a good reason to decline it. But a lot of offices, it's not mandated, it's not recommended highly. So some mothers and fathers are going to have to request the vaccine in these offices, which is a shame.
And you should also be proactive then.
Very proactive. If you don't see them asking you that, you need to say, where is it? Can I get it? As far as the mothers getting themselves, if they work in a healthcare profession, absolutely, I would get it. I've gotten it. My whole family's gotten it. But as far as the routine family, it may not be that necessary for a 30-year-old or a 40-year-old mother.
For more information, the viewers could go log on to cdc.gov, meningitis.com, and nmaus.org.